Hi everyone, welcome to Dr. Deepa's Learning Launch. This is the session for the general public who are very much interested in healthcare and understanding what specific diseases are. Diabetes, as you know, is rampant in the Indian community, especially in South India, where especially the diabetic capital right now is considered to be AP Telangana states, where we have nearly 30 to 40% of the general population living with diabetes or pre-diabetes. So, however, there is this pre-diabetes which is underdiagnosed and it is unrecognized by people, and they do not go to the clinician for checkup, and the regular checkups don't happen in most houses. So, I am starting these sessions regarding diabetes, in which the first session is regarding pre-diabetes, and we will go on with these recurrent sessions of diabetes and healthcare for many months from now on. So all that you have to do is stay tuned to my sessions, stay tuned to what I'm going to tell you. Join these webinars live, where I have a lot of participants today who will ask me questions. So whatever is that which is troubling you, you can always come forward and ask me your doubts. So I am Dr. Deepa. I am the Group Lab Director of Remedies Labs, and I am a pathologist. And I also have degrees of pathology, cytopathology, hematopathology, and autopsy pathology, and I have 17 years of work experience. And on based on these sessions, I will help you with a better lifestyle. I will help you prevent diabetes. So as we walk together on these sessions, you will learn in the next couple of months what exactly to do to prevent diabetes. Because once you are a diabetic, all that you can do is monitor your disease, and lifestyle modifications are something you can work on, and you just have to monitor your disease and pray that you don't land in the complications of diabetes. You'd rather prevent it, and for that you need to work with me. So let's go on to what exactly is pre-diabetes. So in the Healthy Horizons, what you're going to look at is pre-diabetes today. So in the today's session, we are starting with the basics of pre-diabetes, which is critical warning phase of diabetes. And this is the time when the blood sugar levels are above normal, but they are not enough to be diagnosed as a type 2 diabetes. So it's important to note that when you may feel the symptoms and your body is already starting to experience the issues with blood sugar control. So, what exactly is pre-diabetes diagnostic criteria? The doctors use specific tests to diagnose pre-diabetes. So, if you see the fasting plasma glucose of 110 to 125 milligrams per deciliter is considered the pre-diabetic range. Fasting blood sugar is measured early in the morning, at least after an 8 to 12-hour fasting period. And the second test that is used to monitor prediabetes is HbA1c, or glycated hemoglobin, and the range between 5.7 to 6.4 is considered pre-diabetic. Yes, this also is tweaked a bit depending on the age of the individual, but for a general adult population, this is the range. Similarly, you also have oral glucose tolerance test, and the range is between 140 to 199 milligrams per deciliter after a 2-hour oral glucose tolerance is considered to be of a pre-diabetic level. So here is the tricky part. Pre-diabetes doesn't cause overt symptoms. It can happen to you or me. It is not obvious as a disease. However, it is a very crucial and important phase. In the sense, if you miss this out, there is almost a 60% chance that the patient can become a diabetic in near future. So if you are a pre-diabetic, all that you need to do at this point is make lifestyle changes, be very meticulous and disciplined to what your clinician is telling you, and you may never become diabetic. So that is the best part. So the entire possibility of reversal of pre-diabetes into a normal is always there. It is a phase where you have to be disciplined. It is a phase that you have to monitor, and it is the most crucial phase before the development of diabetes. So early detection is crucial, and regular testing and awareness of the disease is also important. So what are the common risk factors? Pre-diabetes is more common in certain ages, that is beyond 45 years of age, who have a family history of diabetes, those who are overweight and have bad lifestyle, and those who are at risk of having lifestyle disorders, those who have family history of metabolic syndromes, those who have family history of diabetes per se, those who have high cholesterol levels. And also it depends on certain ethnicities, for example, African American, Indian, Native American, Hispanics, and Asian. So these are the other these are the ethnicities where you see more increased diabetes. What is the connection between insulin and prediabetes? The core of prediabetes is what is called an insulin resistance. Normally, the insulin helps the body to regularize the glucose in the bloodstream. So, when your cells stop responding to the insulin, the pancreas compensated by producing more. So that level can be measured by the laboratory also, which is termed as insulin resistance. In the sense, there's excessive insulin than expected to be. So in that is also an early diagnostic clue for prediabetes. So this time, where you are not yet a diabetic and you're a pre-diabetic, all the list of tests will be concluded in our next coming sessions. But right now, take it that it is very important that you get it diagnosed early and you be meticulous during the entire treatment. So what happens if pre-diabetes is left untreated? Can I just have insulin, let's say a fasting blood glucose of, let's say, 110, I had it to this month, and then I just ignored it. I just carried on with my sedentary lifestyle, the desk work, and then I didn't bother to go back to my clinician again. Neither have I changed my diet. I am just on the desk job, and then I go out and grab a burger, and I don't care about whatever my clinician does or tells me to do. So what happens if that happens? So if left untreated, the pre-diabetes often progresses into type 2 diabetes. Not only does this lead to a higher blood sugar, which can damage the end organs, but it can lead to serious health problems such as heart diseases, strokes, and all the complications of diabetes, including affection towards the kidney, the nerves, the eyes. So there is no organ that is spared by a high blood sugar level. That is why you need to be very careful. What is the good news? The good news is prediabetes can be completely reversed and managed if there are right interventions at the right time and if you're disciplined to follow what your clinician tells you. So, how important is it to act right now? The key takeaway today is it's never too late to take an action. If your clinician has told you a couple of steps to take last month and you haven't been doing it in 1 month, it's a good idea to start today, right now. So, improving your diet, increasing your activity, managing your stress levels, and will significantly lower your risk of diabetes. So, to summarize, what are the next steps? To wrap up, pre-diabetes is a crucial health alert, and early action is something that will help you completely. And in my next webinar, we will discuss on how the pre-diabetes will lead to diabetes over time and the factors that contribute to this. I will encourage you today to get your lab test done soon. If you're having a sedentary lifestyle, if you think your family history is having diabetes, and if you think you might be at risk, get your lab test done today. And follow my webinars so that you can walk with me into a healthier lifestyle. So let's go on to the question and answer sessions of today's today's webinar. So let's move on to the questions. Let's see if any of the participants have any questions. So let's just go ahead and look at all these queries that people have. So the first question is, dear doctor, what are the steps to be taken and how can we develop the disease so that we don't develop the disease? Okay. So the first thing that you need to focus on is focus on whole grains, vegetables, fruits, lean protein, and healthy fats. Reduce the sugar and reduce the carbohydrates. Reduce the intake of processed foods. Exercise at least 150 minutes per week. In a week, if you exercise 150 minutes, which is a moderate activity such as a brisk walking, cycling, swimming, whichever is feasible for you, just do that 150 minutes in different breaks through a week, then that is good enough. Weight management, try small weight loss. Don't go on excessive starving, because excessive starving is again going to ruin your metabolism. So small weight gains, let's say small weight gains of, you have a target of, let's say, 2 kgs in a month, not more than that. But if that also will go very good in the long run. Good sleep and reduction of the stress is another important thing. So these are the different steps. I hope. Thank you, doctor. Okay. So, is there any data on how many patients become diabetic after pre-diabetes? Okay. So this is a question from Ravi in Chennai, and this says, how many patients from pre-diabetes progress into diabetes? So usually the landmark cohort study of Indian perspective was the CURE study, which is Chennai Urban Rural Epidemiology Study. So in this study, what was found was 9.1 years is the time. So this was through which this entire research had progressed. So in a time period of 9 years, what they found was 58.9% of the pre-diabetics progressed into diabetes during that period of time. So it's a long run study. So that was what was found. And the annual Indian estimate is, let's about 7.8 to 9 per thousand years, and an annualized risk is about 15 to 19%. So this is the annual incident estimates. Let's go to the next question. Are there any medicines required for pre-diabetes? Doctor has prescribed some medicines for me. I am not sure if I have to take it. Okay, so the biggest change maker and the kingpin of pre-diabetes is your lifestyle change, especially for the high risk individuals. But if there is excessive obesity and if you're at a high risk state, then sometimes they do prescribe metformin to delay the progression. How Karthik from Bengaluru says, how often should we get tested, and how do I know I have pre-diabetes? Okay, so if you're an otherwise normal person who's never had issues with the blood sugar levels or the HbA1c, then I recommend that you get tested at least once in 6 to 12 months as a regular health package to make sure that you don't land in pre-diabetes. But if you're a pre-diabetic, you need to get tested at least once in 3 months to make sure that there is no progression. This is Anusha from Borabanda. If my blood sugar comes back to normal, does that mean I am safe forever? No, not necessarily. If your lifestyle changes and or with or without the additional medications, if your lifestyle changes has helped you become from pre-diabetic to a relatively normal level, that doesn't mean it is a forever mark. Doesn't mean that you can abuse food and then have weight issues and all that. But once you get the knack of reversal, then that is, if you have reversed your pre-diabetes, then that is great. What you need to do is, if you have a particular schedule on the basis of which you have become normal from a pre-diabetic, then hang on to it. Continue doing the same thing. Continue the betterment in lifestyle. Continue your good sleep. Continue your etiquette on food. Continue your workout sessions. Continue doing what you just did to reverse pre-diabetes. So what is your take home for pre-diabetes today? Okay, so my take home message for you guys is, don't panic. You're not diabetic yet. Instead, this has to be seen as a golden opportunity where awareness and timely action can prevent you from becoming diabetic. Protect your heart, live long, live healthy, and remember, baby steps every day towards good health will help you achieve pre diabetic reversal. Any more questions? So thank you users for joining. Please stay tuned to my sessions on pre-diabetes. I would be sharing the links for joining in. In case you have any queries, please join the live session and your questions will be answered by me right there. Thank you so much.